Let's now go to acupuncture for emergencies. Let's discuss trigeminal neuralgia. Trigeminal neuralgia, we can use acupuncture on the LI4 point, use acupuncture on the GB8 point, use acupuncture on the Yuyao stomach 2 and stomach 7 points, use acupuncture on the Taiyang GB20, stomach 7, stomach 6, and the LI4 points. Trigeminal neuralgia is a sudden excruciating pain on one side of the face due to a disorder of the trigeminal nerve, which provides sensation from parts of the face and controls some muscles used for chewing. The cause is usually pressure on the nerve from a blood vessel or rarely from a tumor. Attacks may last for a few seconds to several minutes and may be so severe that the person is unable to do anything during them. Afterward, the pain usually disappears completely. An attack may occur spontaneously or may be triggered by actions such as chewing, talking, or touching the face. Attacks may be frequent, though in some cases, there may be long periods of remission. Treatment for this condition is usually with medication, although surgery may sometimes be an option. Trigeminal neuralgia is also called the tic Douloreux, is a disorder of the sensory nucleus of the trigeminal nerve, producing bouts of severe, seconds-long lancinating pain along one or more of the divisions of the trigeminal nerve. Usually, these bouts of pain affect the superior mandibular and maxillary branches of this nerve. According to Western medicine, trigeminal neuralgia's etiology is unknown, and this disease does not result in pathological changes. It usually affects older patients, and the pain is often set off by touching a trigger point or by such activities as chewing or brushing the teeth. Because the pain is intense, even though brief, repeated bouts may incapacitate the patient. This condition mostly affects those over 40 years of age and more women than men. In Western medicine, the diagnosis of this condition is based on its symptoms and history. It is treated with carbamazepine, which is generally effective. However, during treatment with this drug, hematopoietic functions must be monitored since it can depress the bone marrow. Continual use on a regular schedule for 3 months is usually necessary to determine this drug's effectiveness in relieving the pain of trigeminal neuralgia. Phenytoin or baclofen are effective in some cases, and sometimes surgery is used to separate away structures that may be pressing on the nerve. Surgical section of the nerve may also be resorted to in cases of intractable pain. Chinese disease categorization. Trigeminal neuralgia is categorized in Chinese medicine as Totong, headache, or Pian Totong, side head pain, Jue Ni Totong, reverse flow headache, Mian Tong, face pain, and Tofeng, the headwind. Disease causes. External invasion by wind, cold, and heat evils, internal damage by the seven affects faulty diet as well as aging, causing bodily vacuity. The disease mechanisms, if either wind cold or wind heat evils invade the body from outside, they may lodge in the channels and vessels on one side of the face where they impede and inhibit the free flow of qi and blood and thus result in pain. Commonly, it is a defensive qi vacuity due to aging that flow allows these external evils to enter the body. If these evils endure and are not thrust, they eventually result in blood stasis, which causes severe lancinating pain. It is also possible for unfulfilled desires and anger to damage the liver. The liver may lose its control over coursing and discharging, with liver depression transforming into fire. The fire is yang and the liver is yin. Therefore, yang fire evils may shift into the liver's paired yang channel. If this fire ascends along the Xiaoyang, it may harass and congest within the yang channels of the face. By 40 years of age, yin is half consumed. If due to aging, yin blood fails to nourish and moisten the liver may not be able to perform its function of coursing and discharge. Hence, depression becomes more prevalent as we age. If yin fails to control yang, liver yang may become hyperactive and ascend. In addition, because the liver's function is also dependent on kidney yang's warming and steaming, and this also weakens with age, that is yet another reason why liver depression tends to become aggravated with age. The last two scenarios are especially common in women since women are often blood vacuous due to menstruation, gestation, and lactation. If spleen vacuity reaches the kidneys, as it is commonly does premenopausally, chi vacuity evolves into yang vacuity. Further, either chi vacuity, chi stagnation, yin vacuity, or yang vacuity may result in blood stasis, while spleen chi vacuity, faulty diet, or chi stagnation may result in internal engenderment of dampness, which may transform into phlegm and obstructs the channel and network vessels. Thank you for your attention.